Think about that moment, that worry every pet owner feels. You see your dog or cat, and they're just not quite themselves, maybe a bit stiff getting up, or their skin looks off, or they just seem a low energy. It's unsettling, right?
Definitely.
Well, today on the deep dive, we're going to tackle a really complex condition that could be lurking behind some of those unexplained signs. Systemic lupus erythematosus, SLE for short.
And SLE is particularly interesting because it's what we call a multi-system autoimmune disease. So basically, the body's own defense system, the immune system that should be fighting off germs, it starts mistakenly attacking healthy tissues.
Like its own team.
Exactly, a kind of internal mistaken identity.
Right. So to really get a handle on this, we've been digging into canine and feline systemic lupus erythematosus, which is a pretty detailed veterinary resource.
Hmm?
Our mission here is to pull out the really crucial stuff about SLE in pets, what it is, how you might see it manifest, and, what it means for you as an owner. We want those aha moments, especially around this idea of the immune system going rogue.
Okay, so let's unpack autoimmune and multisystem a bit more. Multisystem just means it can affect, well, multiple parts of the body, not just one spot.
Makes sense.
And autoimmune means the immune system is making antibodies. But instead of targeting, say, a virus, they're going after the body's own components, these things we call self-antigens.
So the body's security system flags its own cells as bad guys. And that kicks off a whole chain reaction, doesn't it?
Precisely. These antibodies that are off-target, plus these things called circulating immune complexes, you can think of them like little clumps of antibodies stuck to self-antigen, and even certain immune cells, T cells, getting overly aggressive, they all contribute to damaging the body's tissues. It's an attack from multiple angles, all from within.
Okay, but what starts it all? Why does the immune system suddenly turn on itself like that?
Yeah, that's the million-dollar question. And the honest answer is we don't know the exact definitive cause. It's complex. But research points towards a mix of things.
Yeah.
Genetics is definitely a factor.
Yep.
The environment probably plays a role too. And then there's exposure to certain drugs, the pharmacology angle, and maybe even certain infections could act as triggers, especially in animals that are already genetically susceptible. It's likely not just one thing, but a combination.
So the immune system is kind of caught in friendly fire. How does that actually damage the body? What are the different ways it shows up?
Well, it's interesting. There are actually several types of what we call hypersensitivity reactions involved in SLE. So type 2 reactions are when those antibodies directly bind to the surface of the body's own cells and cause problems.
A direct hit.
Right. Then type 3 reactions happen when those immune complexes, the clumps we mentioned, get deposited in tissues, like tiny blood vessels, and cause inflammation there.
Sort of like collateral damage.
Kinda, yeah. And type 4 reactions involve those overactive T cells directly damaging tissues themselves. So you've got these different ways the immune system can mess things up. Direct attack, complex deposition, and aggressive cells.
And these different attack strategies tend to hit specific parts of the body.
They often do, yeah. We see patterns. So in the joints, those immune complexes often lodge in the synovial membranes, the lining of the joints, and that leads to inflammation, stiffness, pain. That shifting leg lameness we talked about.
Oh, okay.
In the skin, similar things happen, causing all sorts of lesions. The kidneys are another common target, specifically the little filtering units called glomeruli. If those get damaged by immune complexes, the kidneys can start leaking protein, and that can lead to serious kidney problems down the line.
Wow. Yeah, that sounds very serious.
It can be. And it doesn't stop there. SLE can go after blood cells too. Red cells, white cells, platelets, or even the bone marrow where they're made. And honestly, those immune complexes or antibodies can potentially land almost anywhere. Muscle, nerves, the eyes. It really shows how widespread the effects can be when the immune system goes off track.
It really does sound unpredictable, hitting so many different systems. Now, you mentioned genetics. Are some pets just more likely to get SLE?
Yes, there's definitely a hereditary piece to the puzzle. It's usually not a simple inheritance like one single gene, but more complex. Still, certain breeds definitely show up more often.
Which ones?
In dogs, we see breeds like the German Shepherd dog, Shetland sheepdog, collie, beagle, and poodle quite frequently. Researchers have even set up specific colonies of these breeds to study the genetics. They found links to certain types of their major histocompatibility complex, the DLA system, in dogs.
DLA.
Yeah, think of them as protein flags on cells. They help the immune system tell self from non-self. In breeds prone to SLE, certain versions of these flags might make the immune system more likely to make a mistake and attack.
Ah, I see. So it's baked into their genes, in a way.
In a complex way, yes. And there's also a specific SLE-related issue seen in Nova Scotia. duck-tolling retrievers. They get this combination of joint problems and a type of meningitis that interestingly responds to steroids. But generally, looking across all dogs, medium to large breeds seem to be affected more often, with German Shepherds, Poodles, and Beagles commonly cited.
What about specific types of lupus, like the ones affecting the skin? Any breed links there?
There are. German short-haired pointers seem predisposed to a form called exfoliative cutaneous lupus. It causes a lot of skin peeling. Rough collies and Shelties are more prone to a vesicular form, which involves blisters.
And cats. Is it common in cats?
It's generally less common in cats than in dogs, but some sources suggest that Siamese and Persian breeds might be at a slightly higher risk.
Okay. And what about age? Is there a typical age range when SLE pops up?
The average age seems to be around 5 years old, but it's a pretty wide range. We can see it in dogs as young as 6 months or as old as 13 years. So middle-aged is common, but not exclusively. And there was one study in dogs that suggested males might be slightly more affected, but that's not a universally confirmed finding.
Okay, so we've got breeds, age, maybe a slight sex thing in dogs.
Oh.
What are the actual signs an owner might notice at home that should make them think, maybe I should get this checked out?
Right, the history the owner provides is so important. You might see things like your pet being really tired, lethargic, loss of appetite, anorexia, that shifting leg lameness I mentioned, where it seems to hurt to walk on one leg, that may be a different leg later on.
That sounds distinctive.
It can be. Skin lesions are a big one too. A fever that keeps coming back or just persists. General weakness. But, the other signs really depend heavily on which organs are actually being targeted by the immune attack at that time.
So it can be like a moving target, symptom-wise.
Exactly. And the disease often follows this waxing and waning course. Things might seem to get better for a while, then flare up again. And the signs often appear one after the other sequentially, rather than all hitting at once.
It definitely makes diagnosis tricky sometimes because it's not always a clear picture initially.
Yeah, that sounds challenging. So what might a vet pick up on during an actual physical exam that points towards SLE?
Swollen joints, painful joints, that's often a major clue. Usually they're swollen but not really deformed, which can help differentiate it from, say, rheumatoid arthritis. Okay.
Then there are those diverse skin lesions. We talked about redness, scaling, ulcers, maybe loss of pigment, blisters, little bumps or nodules, hair loss. Ulcers can sometimes appear where the skin meets mucous membranes, like around the mouth or nose, or even inside the mouth.
Ouch!
Yeah, a fever that doesn't have an obvious cause, especially early on. Enlarged lymph nodes, lymphadenopathy, including a enlarged liver or spleen, what we call hepatosplenomegaly, sometimes muscle pain or even muscle wasting, and occasionally neurological signs.
Yeah.
It's often the combination of these seemingly unrelated things happening in one animal that raises the suspicion for SLE.
Right, putting those puzzle pieces together. Now, we mentioned the cause is unknown, but you also touched on potentially defective T suppressor cells in dogs. What's that about?
Yes. So T suppressor cells, or regulatory T cells, their job is normally to put the brakes on the immune response, keep it in check. There's some thought that if these cells aren't working properly in dogs with SLE, the immune system might just keep going unchecked, leading to that attack on self. It's another piece of the potential puzzle.
And didn't you also mention something about UV light?
Yes, good point. For animals with skin lesions related to lupus, exposure to UV light, like sunlight, is a known risk factor that can actually make those lesions worse. Something to keep in mind.
Okay. So faced with all these potential signs and complexities, how does a vet actually confirm a diagnosis? You said there's no single test.
That's right. It's really about putting everything together, the history from the owner, the physical exam findings, and then, crucially, the results from specific lab tests. There are actually diagnostic criteria that vets use. To get a definitive diagnosis, you typically need a positive result on either an anti-nuclear antibody test, the ANA test, or an LE cell test. Plus, you need to see either 2 major clinical signs or 1 major sign and 2 minor signs.
Okay, a scoring system, kind of.
Sort of, yeah. And a probable diagnosis might be made with that positive ANA or LE test, plus either 1 major sign or 2 minor signs.
Got it. So what counts as major versus minor?
The major signs reflect pretty significant organ involvement. Things like polyarthritis, the inflammation of multiple joints, glomerulonephritis, the kidney damage we discussed, those characteristic skin lesions, hemolytic anemia, where the immune system destroys red blood cells, thrombocytopenia, low platelet count, and polymyositis inflammation across multiple muscles.
Those sound serious.
They are. The minor signs are still significant, but maybe a bit less specific on their own. Things like a fever of unknown origin, ulcers in the mouth, enlarged lymph nodes you can feel on the outside, inflammation around the lungs, pleuritis, or the heart, pericarditis or myocarditis, or neurological signs like seizures or nerve problems. These criteria help to standardize the diagnosis, given how varied SLE can be.
And I guess ruling out other things that could look like SLE is critical, especially because the treatment involves suppressing the immune system, right? You wouldn't want to do that if it was actually an infection.
Absolutely vital. You hit the nail on the head. Some cancers, for instance, can trigger immune responses that mimic SLE. And certain infections, things like Ehrlichia, Leishmania, Bartonella, which are often tick-borne or vector-borne, can cause signs like fever, joint pain, low blood cell counts that overlap quite a lot with SLE. Making that distinction is crucial because immunosuppressive drugs could be disastrous if there's an underlying infection.
So what specific lab tests or imaging does a vet use to help sort this all out?
Well, several tests help build the picture. A CBC, the complete blood count, might show anemia either because of chronic inflammation or that immune destruction of red cells. It might show weird white blood cell counts, low or high or low platelets.
Okay.
The blood chemistry panel can be all over the place. Really depends what organs are affected. Kidney values might be up, liver enzymes, protein levels. Urinalysis is really important. Finding significant protein in the urine, especially with a high protein to creatinine ratio, but without signs of a simple bladder infection that points strongly towards that glomerular kidney damage.
And what about those specific tests, the ANA and LE cell tests that are part of the criteria? How reliable are they?
The ANA test detects those antibodies against the cell nucleus. A positive result is suggestive, but you can get false positives. Healthy animals might test positive sometimes, or animals with infections, other inflammatory issues, cancer, even some drug reactions.
Oh, okay. So not definitive on its own.
Not definitive, no.
Yeah.
And interestingly, a fair number of dogs, maybe 10–20%, with antibodies to things like Bartonella or Ehrlichia, can also have a positive ANA. False negatives can happen too, though less often. The LE cell test looks for immune cells that have basically eaten nuclear material. It's supportive as positive, but it's tricky to perform, time-consuming. And then there's the Coombs test, or a direct antiglobulin test that's specifically used if the pet is anemic to see if antibodies are stuck to the red blood cells, confirming an immune attack on them.
What about x-rays or ultrasound? Do they help?
They can. X-rays of joints might show soft tissue swelling, confirming arthritis, but usually without bone erosion, which is typical for SLE. Chest or belly X-rays could show an enlarged liver or spleen, maybe fluid if there's pleuritis or pericarditis.
And what about getting samples directly from affected areas, like biopsies?
Yes, those can be incredibly helpful. Arthrocentesis, taking a fluid sample from a swollen joint, often shows lots of inflammatory cells, mostly neutrophils, but they usually look healthy, not degenerate like an infection. And critically, a bacterial culture of that joint fluid should be negative.
Rules out infection.
Exactly. Blood cultures are usually negative too, even if there's a fever. Skin biopsies are often key if there are skin lesions. You need samples for two things: regular microscopic examination, preserved in formalin, and immunofluorescence testing, preserved in a special Michel solution to look for immune deposits.
And what does the pathologist actually see in those samples that screams SLE?
In the joints, they'd see that non-erosive inflammation, neutrophils, lymphocytes, but no pannus, which is that destructive tissue you see in rheumatoid arthritis. In the kidneys, specific patterns of damage to the glomeruli. In the skin, a characteristic inflammation pattern right at the junction of the top layer, epidermis, and the layer below, dermis, often with damage to the skin cells there. Maybe signs of inflamed blood vessels, vasculitis, or inflamed fat, and that immunofluorescence test on the skin can show antibody and complement proteins deposited right at that junction, which is quite suggestive. Vasculitis might pop up in other organs too: heart, brain coverings. Lymph nodes might just show general reactive changes, indicating the immune system is fired up.
It really paints a picture of the immune system just malfunctioning on a wide scale. So, okay, once you have that diagnosis, how do you manage SLE in pets?
Well, sometimes initial hospitalization is needed, especially if things are severe, like a hemolytic crisis where red cells are being destroyed rapidly. But often, pets can be managed as outpatients. Nursing care really depends on what systems are affected. Supportive care is key. Activity restriction is usually recommended during joint flare-ups. Rest helps. And if skin lesions seem sensitive to sunlight, then avoiding excessive sun exposure is important. Diet-wise, if the kidneys are involved, a special diet might be recommended: restricted protein, but high quality, maybe with omega-3 fatty acids added.
And I assume medication is the main strategy to calm down that overactive immune system.
Absolutely. That's the core of the treatment. The goal is to suppress that abnormal immune response and reduce the inflammation. Corticosteroids, like prednisone, are usually the first go-to. You start with a higher dose to get things under control.
Standard approach for inflammation.
Pretty much. But if prednisone alone isn't enough after, say, a week or 10 days, or if the side effects are becoming a problem, then other immunosuppressive drugs are often added. These are sometimes called cytotoxic drugs.
Like what?
In dogs, a common one is azathioprine. In cats, chlorambucil is often preferred because cats can be more sensitive to azathioprine toxicity. Cyclosporine, brand name Topica might be familiar, can be used in both dogs and cats. For cyclosporine, vets often monitor blood levels to make sure the dose is right.
Okay.
And the really important thing with all these drugs is that once the disease is controlled, the dose needs to be tapered down very slowly and carefully. You don't want to stop suddenly. Prednisone is like a broad hammer hitting inflammation, while drugs like azathioprine target certain immune cell processes more specifically, but they all come with risks that need monitoring.
What are some of those risks or precautions owners need to know about?
Yeah, definitely things to be aware of. Azathioprine toxicity in cats, as I mentioned. Both azathioprine and chlorambucil carry a risk of suppressing the bone marrow, which means the body might not make enough blood cells. So regular blood tests, CBCs, are crucial to watch for that.
Makes sense.
And because these drugs suppress the immune system, all of them increase the risk of secondary infections. The body's defenses are lowered, so owners need to be really watchful for any new signs of illness. Cyclosporine can sometimes cause stomach upset, odd skin growths called papillomas, or gum overgrowth, and combining drugs like aspirin with prednisone can increase the risk of stomach ulcers, so that's usually avoided.
Are there other, maybe newer drug options?
There are a few others that might come into play, especially if the standard treatments aren't working well or aren't tolerated. Levamisole is a drug that modulates the immune system. Sometimes it's used alongside a prednisone taper. And drugs like mycophenolate mofetil or leflunomide are sometimes used for specific problems like severe hemolytic anemia or polyarthritis that are hard to control otherwise.
So once a pet starts treatment, what does the follow-up look like? How often do they need checkups?
Monitoring is super important. Initially, the vet might want to see the pet back weekly for exams to see how they're responding. Blood work, CBCs, and chemistry panels are usually checked about a week after starting cytotoxic drugs, and then maybe every 2-4 weeks initially, to monitor for side effects and track the disease activity. The ANA level might be checked again, but it can sometimes stay high even if the pet is clinically doing much better, so it's not the only thing we look at.
And prevention. Is there anything owners can do to stop SLE from happening in the first place?
Because of that genetic link we talked about, the main recommendation is really just to avoid breeding animals that have been diagnosed with SLE. That's the best way to trick and reduce the chances of passing on those susceptibility genes.
What about long-term complications? What are the big worries down the road for a pet with SLE?
Unfortunately, serious complications can happen. Kidney failure is a major concern if there's significant glomerulonephritis. Sometimes they develop something called nephrotic syndrome, which involves heavy protein loss. And because of the long-term immunosuppression, secondary infections are always a risk. Things like pneumonia, urinary tract infections, or even widespread infection, sepsis.
So wrapping it all up, what's the overall outlook, the prognosis for a pet diagnosed with SLE?
It's generally considered guarded. That means we have to be cautious. The prognosis tends to be poorer if the pet has severe hemolytic anemia, significant kidney disease, or develops serious secondary infections. But for pets with milder disease, maybe mainly affecting the skin or joints, the long-term outlook can be more favorable, provided they have consistent management and monitoring.
Okay, so to sum up this deep dive, SLE in pets is definitely a complex autoimmune disease. It hits multiple body systems. Genetics plays a role in who gets it. The signs can be really varied and can kind of come and go. Getting a diagnosis involves putting together clinical signs and specific tests. And management is mostly about suppressing that overactive immune system and supporting the pet. But it's often a long-term thing with an unpredictable course and, yeah, a guarded prognosis.
Exactly. And for you, listening, hopefully you now have a better feel for this challenging condition. Being aware of the possible signs, understanding that the body can mistakenly attack itself, that's the real aha moment, empowers you to spot potential issues and have those important conversations with your vet.
It really highlights how finely balanced that immune system is, doesn't it? And it makes you wonder, thinking about genetics, environment, the immune system, all interacting in SLE. What other conditions, maybe ones that seem totally unrelated in animals and humans, might actually share similar root causes? What could future research uncover about these tangled pathways? Definitely something to ponder. Thanks for diving deep with us today.